My name is Autumn Ta, and Dr. Jayshree Srinivasan performed my atriovenous malformation surgery. So, about a year ago, I had a seizure in the middle of my sleep, and the person I was with at the time, he woke up and realized that I wasn't breathing properly. So, what he did was he tried to wake me up, but I wasn't reviving. So, he called 911. The only thing I remember waking up to was about five different medics in our bedroom. And I was almost like trying to wake up out of a horrible sleep. And it was just like those scenes in the movies you see where people are coming out of like anesthesia or out of a surgery and everything's fuzzy. It was like I was coming out of a heavy sleep. I couldn't piece what was going on. They rushed me to Northwest Hospital, and we were in the hospital all night. They did an MRI and a CT scan. And the ER doctor at the time said, we have you set up for an appointment with Dr. Srinivasan, and we need you to see her later this morning. So I went to Dr. Srinivasan's office, and she explained what I had, which was an atriovenous malformation, was the diagnosis. And she informed me that the best option would be to remove it, and she wanted to do surgery within a week. The whole process was incredibly scary. I've never had surgery before. I've never had a previous history of seizures. So the entire experience was incredibly overwhelming, and she was very calm. Dr. Srinivasan was incredibly calm during the entire process and walked me through it. She's very precise, and she also really seemed to care about what I was going through and seemed really interested in what I was going through and really empathetic. And she seemed like very, very real. She didn't sugarcoat things, but at the same time, she was really understanding. And if I had questions, she was more than willing to tell me and be completely honest. When I was in the hospital, she made sure to come visit me right after the surgery. And then every single day after that, her physician's assistant came to visit me. So there was always someone, either her or someone from her office, that was coming to make sure that I was okay. And that meant a lot. The patient education piece that Dr. Srinivasan offered was amazing. Every single time I had an MRI, a CT scan, angiogram, EKG, I would report back to her and she would explain the results to me. So I was along for the ride every step of the process, like every step of the way. I had an angiogram immediately after to make sure that everything was okay and everything was sealed properly after the removal of the AVM. I also had an MRI right after to make sure that everything looked good. And then I was just at home resting and staying on my anti-seizure medications twice a day. I did have pain medication that she prescribed, and I only had to take it twice the entire time during my recovery. And after about 2 weeks, because it was during Thanksgiving period, I went back into her office, and her physician's assistant removed the staples from this incision site. And then after that, my recovery was slow, but initially, and then quickly and steadily right after. So right now, I'm doing fantastic. I am up to 110% of what I was before. I am back into cycling and CrossFit, all of my regular activities that I was doing before, and I feel no different than I did before my surgery, if not better. I've referred my chiropractors to her and their patients, because my chiropractors have asked me, who did your surgery? Because she did such an amazing job. I feel incredibly lucky that I found Dr. Srinivasan and that she performed my surgery. I feel really, really fortunate to have found her.